Good afternoon, and thank you all for joining us for the WVU Alumni Webinar Series. Today, we'll be talking with Dr. Tara Hulsey, who serves as the Vice President of Health Promotion and Wellness, as well as the Dean of the School of Nursing at WVU. Through a successful and impactful career in research, healthcare, and wellness, Dr. Hulsey is going into her 7th year with WVU Health Sciences. We are so glad to have her at the university, and we are so glad to have her as a member of the Alumni Association. And we're grateful to have her here with us this afternoon to share some exciting updates from the Office of Health Promotion and Wellness, as well as a sneak peek of what's on the horizon for the School of Nursing. Before we begin, I'd like to remind everyone that we'll have a short Q&A with Dr. Hulsey toward the end of our program. So if you have a question you'd like to ask, please drop it in the comment section and we'll do our best to get to it if time allows. Dr. Hulsey, hello.
Hi, thank you for having me.
Thank you so much for joining us today. You have two very, very important roles at the university, and we would love to get started with our conversation today with just an overview of what those two roles entail.
Sure. First of all, I wear the hat of Dean of the School of Nursing. And the second hat that I acquired a couple of years ago is Vice President for Health Promotion and Wellness, and that's for the university. So there's some overlap between the two just because nursing is all about wellness, but they are two totally different roles as well.
Sure. So, what does a day, what does an average day look like for you wearing those two hats?
Well, it's a juggle, that's sure. But I have a great team. I have great people working with me under both of those auspices. And I couldn't do what I do without the people that work with me. I really have to say that. So certainly couldn't wear two full-time hats without the people that I have behind the scenes and sometimes in front of the scenes with me. So I really appreciate that. But it is a juggle. It is, never a dull moment. I'll say that.
Well, I know some of the folks who work on both of your teams, and I'd have to agree with you. They're pretty stellar. So let's start by talking about your role as the dean. Could you tell us about what are some of the new programs and updates just on the horizon for the School of Nursing this year?
Sure. Well, as you know, this is an extraordinary time for nurses. Nursing is everyone's going to need a nurse at some point in their life. So nursing is what I always wanted to do. I knew I wanted to be a nurse when I was a child, and it's a wonderful career. Certainly COVID has brought us a little more front and center, but nursing is definitely a wonderful profession. And as far as the School of Nursing, this semester we have approximately 1,000 undergraduate and graduate students in our nursing programs. We have campuses in Beckley, Charleston, Kaiser, and of course, Morgantown. And our mission is to be a leader in improving health in West Virginia and beyond with student-centered programs, research, and compassionate practice in nursing. So our undergraduate programs include Bachelor of Science in Nursing, and that's really our biggest program. And it's the program that we have in multiple campuses. We also have what we call a fast track program, and that's a program for people who have a Bachelor's of Science or a Bachelor of Arts already, and they come back and earn the BSN. And then we also have an online RN to BSN program. And our student to faculty ratios in the clinical settings are 8-to-1, sometimes less than that, depending on the clinical rotation. And students complete more than 1,000 clinical hours of care. And we have a nearly 100% job placement post-graduation. And I will say that over the years, we have had the majority of our graduates stay in the state of West Virginia, which I'm very proud of. For our graduate programs, we offer a Master of Science in Nursing. We have an MSN MBA dual degree program with the School of Business, and that is the first online dual degree program for the university. Started that just a few years ago. We have master's certificate programs in family nurse practitioner, and we have pediatric nurse practitioner program. This year, we just added an acute care gerontology or gero NP program, which is a huge need. It's a national need. It's been a huge need for the state. It's been a long time in coming. So really, really happy to have just admitted a first cohort for that program. It's a big need for West Virginia. We also have a Doctor of Nursing practice. And we just started, this is our second year in our CRNA program, so nurse anesthetist. That's a big need too. And that program we started in collaboration with Ruby Memorial. So it was a big need for the hospital system, for the state, and it was something that we really have been working on for quite a while. Rounding out our graduate programs is a very successful PhD program, which is it's in nursing, PhD in nursing science. And it was recognized recently as a program of excellence by our WVU Board of Governors. So we recently learned, in fact, just 2 weeks ago, that we've been approved by the Higher Education Policy Commission to open our 5th campus at the United Hospital System, and that's in Bridgeport. And that'll focus on our fast track program, so the one that's for the 2nd degree. And we anticipate that that campus is going to be ready for us to accept students spring of 22. When our students aren't in the clinical setting, they actually have the opportunity to work in state-of-the-art stimulation centers on our Beckley, Kaiser, and Morgantown campuses. And this helps develop and improve their analytical, diagnostic, crisis intervention, and communication skills, because they work with patient simulators that can actually blink and breathe and speak and react physiologically like humans through the computer. We also have standardized patients who are actual human actors who participate in our clinical training exercises, and we use those a lot in our graduate program. The research arm of the school is one that we've really been building over the last few years. Really excited about the growth that we've seen in the research area of the School of Nursing. We now have 10 funded grants, and we've appeared in more than 48 publications, and we work collaboratively with our friends in the other health sciences area schools and programs and other universities around the country as well. And then finally, our students are very involved in student nursing groups, where they have the opportunity to provide outreach on our campuses and in our communities. And I have to say, the community work that our faculty and our nursing students do is tremendous. There's a lot of community outreach, and really proud of that aspect of our school, both from the faculty and the students' perspective.
Wow. So you have a lot going on at the School of Nursing. So you mentioned this new campus that's on the horizon in the next couple years. What are you most excited about? What are going to be some of the positive impacts once this new campus is up and running?
Well, it's exciting because it's a partnership with UHC, and they are actually funding a brand new floor to the building, to the hospital, so that we'll have everything right there in the hospital. And we'll have a skills lab, we'll have classrooms, we'll have a student lounge, we have the faculty offices there. So it's really exciting that we're going to have such a great place, a great environment to expand our program. And the other thing is, we need to produce nurses as fast as we can, and that's not a new thing. But it's a challenge to expand nursing programs, because it's not understood by everybody that you just can't just double enrollment. The nursing faculty shortage is actually bigger than the nursing shortage. So faculty recruitment is sometimes a challenge. It can be. And then clinical sites, because we share clinical sites with our other fellow health professionals, students, and so making in other schools as well. So being able to find enough clinical spots to have the students is always a challenge. But so we need to produce more nurses. This is a great spot in the state for us to do this. It's a great partnership for us to have, and I'm all about partnerships. And this program is the fast track program, so it'll produce the students faster than we can in the traditional BSN setting. So I'm really excited about it. The other thing about that program is that right now, the fast track program is only offered in Morgantown, and we have a waiting list. We have a waiting list of anywhere from 20 to 24 students a year that have to wait for about a year to start. So that will allow these students that we've already accepted to go ahead and start and have the same resources. It's our program, it's our degree, and they won't have to wait. And so that's a win-win.
It is. Oh, I'm so excited about this. And so, when we travel with the Alumni Association, we meet folks who have trained. We've trained with folks who've trained with WVU, all around, and they're using their degrees in different ways. And so I'm really excited to share these updates with them. So, this year has been especially unique. And so, I can't not ask you how the coronavirus has impacted nursing education, and the work that you do.
Well, it's been a challenge, but it's a challenge for all of us. So with nursing, with all of the programs, at least temporarily, we had to move online. Now, our graduate programs are already offered online. And so I have skilled faculty at online teaching, but we had to move our undergraduate program online. And that has probably been the biggest challenge. Faculty were ready to go. We use technology to supplement our didactic education in the BSN program, but moving everything completely online for a period of time was definitely a challenge. I have to give kudos to the students and to the faculty, though. They've done it just swimmingly. Sure, we've had our bumps along the road, but everybody has with this because things continuously change. Clinical was a challenge because we've had to come up with simulated clinical experiences. And we do, as I mentioned, use simulation in our program already, but coming up with those types of high-level case studies and opportunities to learn clinically all online has been a challenge, but we've risen to it. So kudos again to the faculty and staff and students for being able to navigate that. And then I also have to say that, nursing's really risen to the occasion as far as testing. So I had students and faculty in Beckley and in Kaiser and in Morgantown all assisting with the testing. And we also are going to be working with the vaccines administration. So I'm very proud of the students and the faculty. The professionalism's been high, remained high. I do say that our quality of our education has not fallen at all. We're committed to delivering the quality education that we always have. And I have absolutely no reason to think that we have not done that and are not continuing to do that.
Well, on behalf of a lot of people, thank you to you and your team of folks who, as you said, have risen to that challenge and will continue to as we all continue to kind of fight these challenges that seem to be popping up every day, but especially as this vaccine is deployed.
Right.
And so, on that same note, as we transition to talk a little bit about wellness and well-being, I'd love for you to tell us a bit about what's the difference between wellness and well-being, and what does it mean to have an office that promotes that in a position such as yours?
Well, it's really interesting because, wellness kind of means different things to different people. But early on in this role, my office pulled together a leadership team to talk about wellness and what kind of model we would want to have and what would it mean and how do we best communicate that. And so, wellness involves a lot of different things. And, well-being is a component of it, in my opinion. So our office's model is, as you can see on the screen, we have identified priorities, and this is a modification of a national model, by the way, and a wellness model or well-being model. And our priority areas are community, physical, financial, social, purposeful, and emotional. And we did conduct some focus groups and interviews with faculty, staff, and students. And out of those really came the realization that emotional really hits all aspects of those other concepts. And so that's our model. And I'll say, what we've done is we've created priority action teams around each of these concepts. And those priority action teams have identified goals. And what we're in the process of doing is we were going to be linking those initiatives that we currently have and ones that perhaps we will develop with national benchmarks. So that's how we've defined it and how we have built a model and identified ourselves as wellness for the university.
Oh, wow. I love to hear that that you are empowering folks to really think about this. Could you give us some insight into what maybe some of those goals or projects are that, the Office of Health Promotion employs to support well-being?
Sure. I'll say this. When President Gee appointed me to this position, he saw the need for it a long time before it happened, because he and I have been talking about it for years, probably about a year after I arrived. So that's been almost 6.5 years ago. So the thing is that we have a lot of wellness initiatives around the university, and our university is big and we're all around the state. So there was not one office that understood what all was going on. I mean, and some were interfacing and some do interface with one another, and others are out doing their own thing. And so the thought was to come up with a model for the university so that we can strategize and best use our resources and evaluate the initiatives that we do have, or identify areas where we need new initiatives and evaluate those and see what does work, with the thought that this is initially for the WVU family and community, but the goal is to expand it to state and beyond. And so that really is kind of the background behind it. One of the things that we've done, and we have an inventory. My director of health promotion, Amy Sidwell, is updating that pretty much on a daily basis. I think we're over 70 so far, close to 100 current initiatives that we have going on in the university right now. And as you can imagine, that expands on a regular basis when we find out about more things that are currently going on. We've got a lot of great things that we have already rolled out. So this year we have a campaign to recognize the faculty, staff, and the students who go above and beyond their typical roles to support their communities. So remember, communities, that's a component of our model. And so this campaign is called Building Community Wellbeing Wherever You May Be. And we have nominees that have done phenomenal work to meet our WVU community wellbeing priority. And so that's really one of the main campaign things that we've rolled out this particular year. And so as far as plans coming up, one of our major initiatives this year is to limit dangers associated with medications. So our office has been working with the University Police Department to sponsor medication take-back events. And so on National Drug Take-Back Day, we collected actually 38 gallons of unwanted medicines from community members. And we also held 2 events on campus prior to the students just recently moving out the end of this semester. So that was right before Thanksgiving. And so, we know that this year's been challenging for so many people in our community. And so at the start of the new year, we will be conducting a survey that will help us learn how the university is addressing employees' well-being. So we're going to focus on that. We want to be sure that we direct resources where they're most needed. And so that's going to roll out the first part of January.
Oh, wow. I'm so excited about this. We've definitely heard of some of these initiatives, but I think we have some more to learn about if there are 70 of them actively that are active right now. So what we're going to do is we're trying to work through how best to communicate that. It's it changes daily. And so what the office is working to do right now is to categorize those within our model. And we have our website, which I think we'll put up later, but we'll be able to hopefully have a link out from that'll give people, faculty, staff, students information about specific ones and how they fit within our models. So we're working on that, and that is to come, but I think that's going to be a really important resource for the university. Absolutely, it is. And we'll be very excited about that. so before I continue to ask some questions, I want to remind the audience, if you have questions, feel free to drop those in the chat or submit them as a question. And here in a couple moments, we will start to ask Dr. Hulsey some of those questions from the audience. But in the meantime, I have a couple more questions. And one of those, Dr. Hulsey, is I'm wondering, for a lot of our alumni and friends who are at home right now, do you have any tips for us and in ways that we can focus on our well-being during the winter season?
Yeah, well, I mean, I think given we're in COVID crazy, certainly following the CDC guidelines, I think is going to be important over the holidays. That if you can really stay and celebrate the holidays with your family members, people that you live in the same house with, that's ideal. Of course, continuing the hand washing, the physical distancing, and the mask wearing, all that's for physiological health, and so definitely we do need to continue to do that, even though vaccine is rolling out now, as I think everyone knows. So I also, if you can't be with your loved ones that don't maybe live in your house, certainly if you can connect by video. Or by phone, that's going to be important too, from a psychological perspective, of course. And if you find that you do need additional support, I would say please don't hesitate to reach out to a behavioral health professional, because that's really been a big aspect, I think, of COVID has been, depression, and it's huge, it's real. And I think that we really all need to take it very, very seriously. And so I would just really encourage, if anyone is feeling like they could benefit from some assistance, please to not hesitate to reach out.
Thank you. Thank you for sharing that. And, we as an alumni association have been really appreciating some of these moments, virtually connecting with folks. We, of course, very much so miss welcoming people into the Erickson and traveling around to connect with our mountaineers all around the country. But, we very much so encourage folks to do the same, so that one day we can absolutely get together at the stadium again, right?
Exactly. And I can say too, I mean, I've really missed, traveling around and visiting with our alumni. I've done a lot of that in the time I've been here pre-COVID. And I mean, I really have to say that I think that the WVU alumni are definitely some of the most passionate and loyal that I have ever met. And this is my third university. So it's just, I have definitely missed that. And I have an advisory team that are made up of alumni, and they're extremely supportive and always have been. And I think the world of them. And we only meet 2 or 3 times a year, but we've always enjoyed getting together because they're all around, the state and out of the state, not even in the state. So we've really enjoyed being able to meet face to face and for them to reunite, since some of them were classmates. And so we've had to, go virtual, and that's been a little bit of a challenge too. I mean, we do it, but it's not as, we all want to see each other. I mean, people love people, right?
Absolutely. Absolutely. And, I'm glad that you brought that up, because as we transition to start to take some questions from the audience, the first one that we have is actually related to your transition to West Virginia. And so that first question is, coming from South Carolina to West Virginia, what has been something that you've come to love about this community and your role here at WVU?
Oh, I love it here. I really do. It was a no-brainer. I wasn't looking to leave South Carolina. I loved my position. I was in a dean position there as well. And I've been in that position for about 8 years, and I have really enjoyed it. But when this opportunity occurred, and I actually came on campus to interview, it was not the first time I'd been to West Virginia, but I didn't know much about it. And I knew the minute that I interviewed here that this was where I needed to be. And the people are just incredibly friendly here. I felt that from square one. And I go, since I have campuses down in the southern part of the state, I'm actually in Charleston right now. I go back and forth from Morgantown to Charleston and around the state to visit our campuses and all. And it's really interesting how it's one state, but different pieces of it are so different than the others. I mean, and I don't mean just geographically, I mean just culture-wise too. It's been really fun to get to know the state. But again, the people have just been, they were welcoming from square one, and they continue to just be just wonderful people. I think West Virginians are just phenomenal. And the other thing is, as far as health goes, there are not too many differences between South Carolina and West Virginia. Those two states have a lot of the same negative health outcomes, a lot of the same challenges. So it was really an easy transition for me to come to West Virginia, and definitely one I have not regretted.
Well, we are very glad to have you here. On behalf of WV, we're so glad that you made it. And so our next question from the audience is specifically about some of the nursing programs, and that is what information or evidence-based practice curriculum learning opportunities do you offer in the BSN, MSN, DNP, and PhD programs?
I would probably, well, it's in all of our programs, to be honest with you. Evidence-based is a curriculum thread through all of our programs. So it varies depending on what degree program you're in. For example, I mean, our research is evidence-based focused from a doctoral perspective, but we also have that in our undergraduate programs as well. So evidence-based practice is a big piece of our curriculum. It's a big part of how we approach practice as well, very much so. So it's integrated throughout all of our programs.
Great. And so why do you feel that someone from West Virginia should study nursing at WVU?
Well, our history speaks for itself. So we have a longstanding, highly regarded nursing program. Our outcomes are very strong. Our NCLEX pass rates have been continuously very high. And we have a rigorous approach to evaluating our curriculum. Our faculty regularly evaluate courses. We have a whole process for that, and it's done through a curriculum committee. And so we are very dedicated to high quality, and our grads speak for themselves. The employers want our grads. I hear it over and over and over again. I cannot tell you how many times I hear we want a WVU grad. So I would say those are some good reasons to think about WVU nursing.
I love to hear that. I love to hear that. So, for School of Nursing alumni, how can the School of Nursing alumni stay engaged and continue to move the program forward?
Yeah, well, there are a lot of ways. As you can see, we're growing. I mean, this is the 60th year of our School of Nursing, and we are just continuing to grow. So we do have a lot of needs, and we do have a School of Nursing magazine that we put out, and I'm hoping we'll have one of those coming again soon. But I would say follow us. We have a Facebook page if you're into social media. We do try to reach out to our alum. If there's an alum on the webinar that is not receiving information from the School of Nursing, I really hope that you'll reach out to us and let us know so that we can be sure that we have your correct information. I do have a director of alumni who is in our office and has been with us, has been with the university for over 20 years, came from the Alumni Association, Greg Cave. And so he does work with our alumni. I love the alumni. It's been sad to not be able to have our alumni tailgate, which we just started 3 years ago, and it's been a huge hit. It's grown. I mean, it was big the first year, but the last 2 times it's been really great. And alumni love it. And I love seeing them, and hopefully we'll be able to do that again soon. But please, I would say follow, our information on our website. Please don't hesitate to reach out to me because I love touching base with alumni. If there are alums that would like to be even more engaged, I would love to add more to my advisory team. So if there's interest out there in that, there are other ways that alumni can actually really closely connect with the activities of the School of Nursing. So depending on what the interests are and, specific areas of expertise, we can definitely find areas that alumni can work with us more closely, and glad to do so.
We are so glad. And like I said earlier, it's very rare on our travels as the Alumni Association to meet, to be in a group of people and there not be an alum of one of the nursing programs. So, for us, for me to pay a visit to Ruby and not find someone there who is just a very proud School of Nursing alum. So we're glad to hear that.
And I have to say, a lot of our graduate students and our faculty have come back for graduate and doctoral degrees in our program. So we have a track record. That's another reason. We have a track record of our undergraduate grads coming back for our master's program. So I think that speaks to our programs as well.
It does, absolutely. And we are always glad to hear when Mountaineers are coming back home. We just love to hear that, and hopefully someone will hear that today and be inspired to come back from Morgantown. So, yeah. And so we have another question from the audience. How are you promoting leadership abilities for students to use and grow as they enter into their professional nursing journeys?
Okay, so I'm not exactly sure if you're talking about that question refers to within the nursing program, but we do have within our undergraduate program, we have a whole leadership semester. So we do clinical placements and leadership opportunities for the students when they're seniors, actually. We have a lot of community partners, and I am always looking for more community partners. And so those offer leadership opportunities to students and to connect new grads to opportunities there as well. And then, of course, leadership opportunities there again, I have to say lifelong learning. Nursing's lifelong learning. So continuing your education is important, because I can say I did not aspire to have a master's degree and I didn't aspire to have a PhD, but I can sure tell you that when I decided to do each one of those, they opened leadership doors that otherwise would probably not have been opened for me.
Thank you. And so we have our last audience question of this afternoon. And so that question is, how has the expansion of WVU medicine and hospitals around the state and neighboring states impacted the School of Nursing?
It really hasn't, other than really kind of increased some of our clinical opportunities, to be honest with you. But we use hospitals that are outside of the WVU hospital system anyway. But it does make it a little easier for us and offer more opportunities for our students. Other than that, really hasn't impacted us. I sit on the hospital board, and I have to say that the acquisition of the hospitals that has been happening over the last year and a half, 2 years, they've been very thoughtful, and they've been win-win situations. So there's situations where, hospitals that maybe were not potentially going to be able to survive have now been able to grow and get stronger and add to our system, and for us to add to those our footprint in those communities as well. So I think that's a win-win. But that.
Well, for me, it's really nice to be able to drive. I grew up in Pennsylvania, right over the border, and it's so nice to just drive through my hometown and now see WVU Medicine's logo, which is really great. So anyways, so as we conclude our conversation today, I know there are going to be a lot more questions that our alumni and friends at home are going to have. What are the best ways to stay connected with the School of Nursing and the Office of Health Promotion and Wellness?
Yeah, we have a web page for each of those, and I think and those actually you could even just Google WVU Nursing or WVU Health and Wellness, and it will come up, or Health Promotion and Wellness, and it will come up. But those are our two websites. That's the best way. Again, my email address, if you want to reach me, is easy to find too. It'll be on our nursing website. It's right there, as well as our nursing mainline phone number too. So please don't hesitate to reach out, contact, and let me know what your questions are, and happy to answer them and look forward to the conversations.
Well, Dr. Hulsey, thank you so much for being with us this afternoon and for all that you do to promote the health and wellness of our WVU community and our friends in West Virginia and just everyone throughout the state. We thank you. And to those who are joining us at home today, we wish you all an enjoyable and safe holiday season. And we can't wait to see you all for the next event in our WVU Alumni webinar series in January of 2021. So everyone, have a good night.
Thank you.